Okay, good afternoon, friends. Today I am very happy to be with Dr. Anusha Agarwal. She's NEET rank 39 in her first attempt with internship or immediately after internship. And thank you so much, Dr. Anusha, for being with us here today.
Good afternoon, ma'am. Thank you so much.
Okay, so Anusha, जब result आया, what was your first reaction? You were with your mom, right?
Yeah, I was with my mom and I asked my mother to see the result, please, because I was really scared to see it. And then she saw it, and then we were both howling and we were all both crying because we were really happy.
Alright, and this is just 2 days before INI exam, which
Yeah,
also you
yeah,
were
yeah,
doing.
actually.
All right. So वो feeling कि भैया मेरा all India rank 39 है, has it sunken in, or are you still in the zone of whether it's a dream?
It's always a dream to like score a two-digit rank, right? So yeah, it's still sinking in.
All right. So Anusha is a graduate from the prestigious King George Medical College, KGMC, the dental wing of KGMC in Lucknow. And Anusha has been a foundation course student. She's started her preparation from third year onwards. So Anusha, please let us all know ki, how did you start and what was your strategy in third year and final years?
Actually, I bought the course in third year and it was a foundation course. So I used to I'm actually a book reader kind of person. So I used to read books and then I would watch the videos and then for the extra knowledge. And then I would like prepare notes accordingly and then I would just revise them. So it was really helpful.
So from third year onwards, you were in the zone of doing an MDS program.
Yeah, I actually wanted to do MDS. I always thought about that. I want to do MDS. So yeah, uh, I actually had this mindset and I prepared accordingly. It wasn't like I was really into studying in third year, nothing like that. But I was I would say I was consistent,
Right.
nothing else.
Okay. So धीरे धीरे करके gradually you started coming to the
Yeah.
tune of how कैसा पूछते हैं क्या आता है and all of that.
It's not, I would not ask people to just like study 18 hours in third year. No, nothing like that. Just be consistent, just cover your portions and study every day, even for 1 hour or 2 hour. I would say third year, though, in our college, actually, third year is called the honeymoon period. You're supposed to chill. So,
Correct.
yeah, so I would not say to just because it will burn out you at the end. So
Right.
just be consistent, and that's what I would suggest.
Right. Then came the mighty final year with all those subjects together. And did you still continue doing this extra preparation with your final year standard textbooks also?
I would say it was a bit difficult because it's final year and you have to go eight. There are 8 subjects and then there are quotas in our college. So
Definitely.
yeah, it was difficult. But then again, I would just I would go through books, I would go through videos, and then my strategy is really simple. I would just go through books and I would watch videos for the extra points, and then yeah, and then I would just jot it all down and then I would revise. That's exactly what I've done. It wasn't like I had any particular strategy towards it. It was just I was doing what I should be doing. That's it.
Right. And you were doing it consistently.
Yeah,
That's
that's what I was. It's not like I didn't enjoy. I enjoyed, but there was little compromises I made, yes, but then I was consistent, nothing else.
all right. So all those who think that it was a piece of cake for Dr. Anusha, it was not really. In the beginning of internship, if you allow me, Anusha, she had a little health problem also. If you can elaborate about it.
It was I actually fell from the staircase, so I broke my back. It was yeah, so I was on bed rest, and when actually, since see the thing is, when you are in bed rest, you cannot like actually sit and study. You kind of feel hopeless, even if you had so many days left, even if. But then I came back, and then I studied.
What
Like
happened?
I actually
You had a spinal fracture, right? In the
yeah
beginning of your internship.
yeah.
So you were operated upon, or just bed rest was
No,
advised?
I was on bed rest. Actually, it was T4 and my tailbone. So
Right.
I was not able to sit. That was the, I think that was a major problem. So
Okay.
yeah,
So you got an extension into your internship also?
yeah, I was supposed to, but then yeah, got managed.
Okay. All right. So with a quota full to complete an internship with a spinal injury, internship mein what was, how did you do it? That's the
Oh my
biggest
God.
question. I think a lot of your juniors would want to know that, internship in a government college, I mean, you have, I think, 5 CDs to make and so many RCTs to do, so many extractions to do. So with that quota, with a 9 to 5 regular college, what did you do? How did you do it?
Okay.
Tell us everything. From
Again,
when did you get up to when did you sleep? Tell us, please tell us everything.
when I was again, I would just go to my college. Like it's we have to reach there by 9. So I would just go to my college. I would come back, and the timing varies according to the department. Some department have quotas, some do not. So yeah, so wherever there used to be some any department jahan pe there is come workload, then I would study more. But then if it's an oral surgery department, I have to stay there for 4 and 5, and you have to actually work there. Then it would get really tiring. But then I again consistency. I would study like for at least I'll make time there, study for 1 or 2 hours.
Hmm.
Yeah, that's exactly what I've done. Seriously, on a very serious note.
And when you come back from college, then you take some rest.
Yeah. I used to sleep for like for 1 hour. That was really my schedule. I used to sleep for 1 hour to take my mind off to whatever happened in the college, and then I would go back to
Study.
study.
In
Yeah.
the hostel, you were a hostelite there
Yeah,
in.
yeah, yeah. Yeah. I actually belong to Bareilly.
Okay.
So yeah, I was living in hostel in Lucknow.
Okay. So after internship, did you still stay back there in Lucknow or did you go home and do rest of your preparation?
Yeah, it actually since our internship ended in February, so I was there. Obviously, I was had to be there, but then I thought of coming back to home, but then actually I kind of stayed there only in the hostel.
Hmm.
So I was there. I gave my exam in Lucknow, and then I came back home.
Okay. So
Yeah,
that
so
will
I was
move
there.
to continuation break now, study key probably for that.
Yeah, because I had all the walls set up and sticky notes and everything, so I didn't want it to like yeah.
Disrupt that, right?
Yeah.
Absolutely makes sense. So, Anusha, you were also very regular in giving GTs. I mean, you always had a score over 700 in the GTs that you gave. So, usually now students get depressed when their GT scores around 200. I'm sure when you must have started your score, didn't start with the
Yeah.
700 score.
No.
So, how did you prepare for the GTs and how many GTs did you give?
Ma'am, I used to do MCQs, a lot of MCQs. I would just revise them, and then um, I would say I used to give a lot of exams regardless of the mask, just to understand the questions or just to know ki what type of questions can be asked. So initially, I used to give a lot of tests, and then later, um, my score improved, obviously.
Okay. So those GTs, would you recommend your juniors to take GTs because बहुत डरते हैं बच्चे अभी तो मैंने पढ़ाई नहीं है अभी मेरा
Yeah.
नहीं हुआ है
Actually, I had nothing like that. I used to just give it. I mean, I'll only learn one more MCQ. I think that's what I think. I used to think like that, and I
Hmm.
would definitely suggest students to give like a lot of do a lot of MCQs, even if it's in a form of a test. I mean,
Right,
it's gonna help you somewhere down the line. That's what
right.
I think.
Okay. So towards the end, Anusha, you knew that your scores are in the range of 700s. Did you have an idea that I'm going to do well? Did you have that confidence, or it was just I don't know what's going to happen, Mala thing?
Now I'm actually a very um, pessimist kind of person. So even if the score was nice, but sometimes the score would drop according to the GT, right? So I wasn't no honestly I wasn't thinking I could score that well. I wasn't that a positive kind of person, but it just I was again consistent, and I thought that God will make it happen for me. So yeah, it was my parents' blessing and my God's blessing. So yeah.
Right. So, Anusha, do you have your mom around? I mean, can we have her with you?
Yeah, I can call her.
Yes.
Mummy, आ जाओ।
She's a big part of your success, I think. And
100%. I mean, there is no doubt about it.
नमस्ते आंटी, कंग्रेचुलेशंस आपको, बहुत बहुत कंग्रेचुलेशंस। आपको कैसा लग रहा है अनुषा का इतना अच्छा रैंक आया है फिर? शी इज नॉट ऑडिबल अनुषा, वी कांट
थोड़ा
हियर।
तेज बोलो मैं।
कैन यू मेक अ सिट विद यू? डू यू हैव अनदर चेयर अराउंड?
हाँ, अब यहाँ बैठ जाओ। यहाँ आ जाओ। मे कैन आई मेक अ सिट एट माय प्लेस
ऑफ
फॉर
कोर्स।
लाइक 2 minutes?
या
तेज बोलो थोड़ा। जी।
कैसा लग रहा है आंटी आपको?
बहुत अच्छा लग रहा है, बहुत खुशी है। और इसमें
आपकी आवाज नहीं आ रही है आंटी।
मैम बिल्कुल भी नहीं आ रही है।
तुम्हारी आ रही है, आंटी की बीच में गायब हो जा रही है।
फिर से बोलो, थोड़ा तेज बोलो। दूसरा दे दो। हेलो, अब आ रही है?
हाँ, अभी बिल्कुल क्लियर है आंटी।
ठीक है।
बताइए।
तो यही है कि इसके एक तो मैं भगवान का बहुत बड़ा आशीर्वाद बोलूंगी। दूसरी चीज ये कि इसने अपनी मेहनत बहुत करी, कम समय में बहुत अच्छी मेहनत करी। और ये घर आने के लिए कहती भी थी, तो मैं कहती थी बेटा हॉस्टल में रह के अच्छे से कर लो। और वो उसने किया। और हेल्थ भी इसकी बहुत बीच में खराब हो गई थी, फिर भी इसने हिम्मत नहीं छोड़ी, जबकि ऐसी परेशानी में तो कोई भी बच्चा हिम्मत हार जाता।
हम्म,
तो वो चीज भी इसकी हिम्मत रखी इसने, और पेपर को दिया तैयारी करके। तो हमें बस इसी बात की खुशी है कि इसने मेहनत करी, मेहनत सफल हो गई। बस ये थोड़ा सा रहा।
तो
जी।
जो बाकी पेरेंट्स हैं, जो कई बार ना लड़कियां होती हैं जो इस समय शादी का भी चल रहा होता है, बहुत कुछ होता है, आई मीन, तो
जी।
आप लोगों ने आई एम श्योर बहुत सपोर्ट किया होगा अनुषा को ये चीज को
जी।
करने देने के लिए। कई बार ड्रॉप भी लेना पड़ जाता है बच्चों को, पर इसने फर्स्ट अटेम्प्ट में क्लियर किया है। सो
जी। जी।
आप पेरेंट्स से क्या कहना चाहेंगे, उन सभी पेरेंट्स से जो जिनके बच्चे अभी इस कंडीशन में हैं, अनुषा वाले स्टेज में हैं?
जी।
क्या
मैं तो
कहना
मैं तो यही कहना चाहूंगी उन पेरेंट्स को कि भाई देखिए, एक तो यही एज है अपना करियर बनाने की, है ना? तो बनाने दें, बच्चे जितना पढ़ना चाहता है उसे पढ़ने दें। और शादी तो बाद में बच्चे कर ही लेंगे, कोई ऐसी वो नहीं है। लेकिन ये समय लौट के नहीं आएगा। तो मैं तो
जी
भाई यही कहूंगी कि माँ बाप पूरा सपोर्ट करें, बच्चियों को तैयार करें उनके आगे के जीवन के लिए।
जी
और मैं तो यही कहूंगी, देखिए बस, और मैं कुछ नहीं कहना चाहती हूँ कि ये जरूरी है लड़कियों के लिए पढ़ना और कुछ बनना, उसके बाद शादी तो हो ही जाएगी। शादी
जी।
किसी कोई वो नहीं है
कितने
जी।
घंटे पढ़ती थी आंटी अनुषा? वैसे तो ये हॉस्टल में रह के पढ़ी है, बट
जी।
कितने घंटे पढ़ती थी?
जी, अब वो मैं एकदम घंटे बता नहीं सकती, लेकिन हाँ अभी हम फोन वोन करते थे तो मैं पढ़ रही हूँ। कभी कभी परेशान भी हो जाती थी, इमोशनली रोने भी लगती थी, लेकिन वही है कि हिम्मत बनाते रहते थे यहाँ से, तो
सही।
चलता रहता था। जी। जी। यही
ये
है।
बहुत बहुत बड़ा सपोर्ट होता है आंटी पेरेंट्स का, एंड आई एम सो हैप्पी
जी।
कि आई एम श्योर अंकल एंड यू बोथ हैव बीन वेरी वेरी सपोर्टिव।
नहीं देखिए, मैं तो यही कहूंगी, पेरेंट्स का तो है धरती पे सपोर्ट, मैं तो कहती हूँ ऊपर वाले की आशीर्वाद बहुत बड़ा सपोर्ट होता है। मेरे को तो, मैं तो यही मानती हूँ, और मुझे मेरे बच्चों को आशीर्वाद ऊपर का मिला है, ईश्वर का, तो मेरे लिए बहुत बड़ी बात है। जी।
जी। सो अनुषा, आई थिंक विल कम बैक टू यू एक बार। सो व्हाट नेक्स्ट अनुषा, वेयर इज द पार्टी नाउ?
तो एक्चुअली आपको, इफ यू नो कि केजी में बॉन्ड होता है, वी हैव टू सर्व अ 2 years बॉन्ड, सो इट हैज जस्ट कम आउट। So we are supposed to actually report in between 23 to 29. So there is no party actually happening.
अरे एक दिन की छुट्टी तो यू कुड हैव आस्क्ड, नो?
Yeah, I would ask. Once I get the joining, I would ask, definitely ask.
सिंसियर बच्चों के यही प्रॉब्लम है, एक पॉइंट के बाद पार्टी करना भूल ही जाते हैं। नहीं, प्लीज पार्टी करना, प्लीज पार्टी ऑन ऑल ऑफ आवर बिहाफ। सो व्हाट नेक्स्ट अनुषा, व्हाट इज इट दैट यू आर लुकिंग फॉरवर्ड टू विद द रैंक 39 ऑल इंडिया?
Actually, my favorite branch is oral and maxillofacial surgery,
ओके।
and I really want to. Sorry, ma'am.
व्हाई इज इट ओरल सर्जरी फॉर यू?
Oh, I don't know. I mean, ma'am, I have not seen any other branch. I always had my eye on oral and maxillofacial surgery for some reason. It's just I really want to. Uh, I've actually some sort of interest in oral cancer, and I really want to go in that field. So yeah, somewhat.
All right. Okay, Anusha. So, before we wind up here, what is the one message, one or two messages which you would want to give to your juniors, with which they would probably look up to you and say, "कि एक दिन मुझे भी Dr. Anusha की तरह, I want to be there where she is." What would you want to tell them?
Uh, Ma'am, I'm not like I don't have really much to say, but it's just I like I said earlier also, it's consistency and hang in there. I would say just do not give up because circumstances always change. Doesn't always have to be bad, doesn't always have to be good. So it can go either way for you. So just hang in there and be consistent. That's it.
All right. So everybody who's listening to Dr. Anusha right now, please remember this is one thing which I think every topper there for every exam would tell you that consistency is what you need. Just be there every day, show up, and
Yeah.
thoda karo, but roz karo.
Yeah.
Right. So Anusha, once again, heartiest congratulations to you, dear,
Thank you,
and
ma'am.
uh, we'll party together very very soon.
Thank you, ma'am.
All right. Thank you so much. Just wait.
Done, ma'am. You